Hi. So my name is Gabrielle, and I'm basically gonna tell you a little bit about myself and tell you what I do on a daily as a type 1 diabetic. So I was diagnosed at the age of 12 with actually type 2 diabetes, and doctors weren't sure why I had type 2 at the age of 12 because they said that was rare that people get at that age, because type 2 normally you would get it like if you're older or whatever it may be. But so I started off type 2 and I was hospitalized because my blood sugar was over like 600, and at that time I did not know I was diabetic. I started off with
conditions and disease of diabetes. Diabetes is a disease that occurs when your blood glucose, also known as blood sugar, is too high. Different types of diabetes. There's type 1, which is adult onset, and type 2 that you're born with it. Reversible diabetes include gestational diabetes, which is while you're pregnant, and pre-diabetes, which occurs when your blood sugar levels are higher than normal but not high enough to be classified as diabetes. The population affected is about 15.9 million people per year. And the cause of diabetes is due to either the pancreas does not produce enough insulin or the cells of the body not responding properly to the insulin that is produced. You are more likely to develop type 2 diabetes if you are the age 45 or older, have family history of diabetes, or you're overweight. Physical inactivity, race, and certain health problems such as hypertension, which is also known as high blood pressure, can also affect your chance of developing type 2 diabetes. Treatments. Even though there's no cure for diabetes, it can be treated and controlled. Treatment for diabetes include diet, exercise, medication, and insulin therapy. Anti-diabetic medications, they have some which are anticoagulant, statin, and insulin, help control diabetes. And managing your blood sugar levels also helps with controlling diabetes. So again,
I haven't had any food yet, so this is without food, and I hope it's not high. Lately it's been really high because with being sick and then not sick, like anything will trigger a high blood sugar, and been really rocky lately, so I poke my finger. I already washed my hands, so sometimes it won't come out though, and I just have to press down till it comes out, because my hands are pretty cold right now. And we'll see how it comes out, if it's high, if it's low, or what it is. So yeah, it's pretty high right now, and that's because honestly, I cheated on my dinner. I actually had a lot of carbohydrates, and yeah, it's not too good. So I do have to take insulin for this. So since I had a high blood sugar, I am going to have to inject some insulin. My Basilar, I take it twice a day, and it's 18 units in the morning, 18 units at night. Today I started off a little bit later because I do have a baby, so I had to work with that, and then I slept in. So I'm going to inject 18 units of Basilar insulin, which is my long-lasting. So you always want to take the bubbles out, make sure there's no bubbles in. And then I inject it to 18 units. I don't know if you can see that. And normally I do my stomach, so I'm going to 18 units of Basilar. I rotate the areas because you can get bruises, you can, just a lot of things you can't inject on the same side. So I injected 18 units on my long-lasting.
signs and symptoms. So an overactive bladder, polydipsia, which is excessive thirst, polophagia, also known as hyperphagia, is increased hunger, diminished vision, general abdominal pain, cramps, myoclonus, which is muscle spasms, loss of sensations, back pain, aches, soreness.
So yeah, at the age of 12, I was already experiencing loss of weight. My appetite had changed. I had a lot of hair loss. And then on top of that, I was thirsty, like non-stop being like thirsty, and had to use the restroom constantly. So at that point, I let a few weeks go by, and then it freaked me out. So then I went to Madera Community Hospital, and that's when they diagnosed me at the age of 12 with type 2 diabetes. So it was a little rocky here and there. I had to go. They discharged me, whatever, gave me some insulin. Next day, I had to go back because the numbers just weren't going down. So at that time, I was hospitalized for like about a few weeks. And then I had to go home and learn.
The prognosis depends on the duration of the diabetes, the degree of blood sugar control, and the development of complications. So it basically just depends on each individual. There could be a different prognosis, some more severe.
Since I've had diabetes for so long, I do have a lot of fears with it, and I do have a history of diabetes with my family on my mom's side and my dad's side. And it just scares me because I'm just like, I'm good one day, the next day I'm bad. There's like no in between, but I mean, like, I learned how to manage it when I'm low. I know the feeling when I'm low, I know the feeling when I'm high, without even checking. And my fear is just passing it on to my daughter and she having it in the long run. Thank goodness she doesn't have it, so that's good. But I constantly do work out. I have to work out because my fear is gaining weight and my diabetes just goes out of whack. So my weight has been up and down, but it's been manageable. I do constantly walking, constantly.
And here's my references. I went to this website, and of course interviewing my cousin who is a diabetic.